Hello, good morning. So today we are talking with Dr. Brita from Progress Through Play. She is speaking at the FamSummit, which is happening July 30th through August 1st. Each day is covering a different sort of topic range. So day one is all about pregnancy, birth, postpartum. Day two is about ages 0 to 2. And then day three is all about ages 3 to 5. And is it Brita or Brita? Am I saying it
Brita,
correctly?
Brita, you got it. Yeah.
Good morning. Thank you for joining.
Oh, of course.
And so on day two of the FAM Summit, you were talking about mobility and milestones, which is a really big topic. And I love that you talk about containers too, because until recently, I feel like they've just been heavily promoted and people are like, yeah, the sooner my kid can do this or that, the better. And so we kind of have this like competitive mindset when it comes to baby milestones.
Yeah.
Isn't necessarily the right mindset for development and like the whole health of the child necessarily, right? Can you talk a little bit about that? And also, how did you even get into this? It's like, I mean, you're a parent, you're like, wow, I want to know everything this person knows about this, you know?
Yeah. Well, so I've been a pediatric physical therapist for 10 years now. And throughout that 10 years, I've worked in a variety of settings because that can look very different from working in the school system to working in a clinic, working in the hospital, right? And through working in all of those different settings, I really found a passion for early intervention, right? Which is our youngest kiddos, because I just saw how important it was to set that foundation early and give those kiddos the best chance at success in their future development. And so I really honed in on pretty much infant and toddler development. And then I had my own kids where I, was kind of thrust into this, motherhood community where I really got to see things from a completely different perspective. That even as a pediatric physical therapist, I didn't quite understand, right? And so through that experience of having my own children, I came to really understand a different perspective on all of it and how understanding what's going on with your child is so empowering and helpful for parents to really form deeper connections with their kids and be able to engage with them and foster that development and kind of also sit back and like relax a little bit and not be so stressed. Or I just posted today about milestone anxiety, and I really think that this like education piece is so helpful for that. And so I decided after, having my two kids that I wanted to go out on my own and create a practice that I felt really supported parents from the very beginning, and hopefully even prevent a lot of the things that I was seeing down the road in older kids, and also just be there, right? As a support, even if your kid doesn't need traditional physical therapy per se, I just want to be there to help you, foster that connection and feel good about, what you're seeing in your kid and be able to sit back and enjoy just playing with them. And so that's kind of how I approach
So
things.
huge because is so worried about stones all the time. There are different resources that try to help parents understand it, because I think once you understand it, you're not, like you said, you're not as stressed out about every little thing. You're not comparing your child as much. But also you're more understanding of, oh, this is what's going on with them. That's why they're being cranky. That's why
Oh
maybe
yeah,
like what
the
they
sleep
were.
regressions.
And then you're more understanding of your child and less like frustrated, I feel like, which is very helpful for the whole family. Because you need to
Absolutely.
be, sometimes we need that information, that education to be in that mindful, like, okay, Oh, okay, I get it. All right. I know what's going on. So let me help you with this instead of just like, I don't know what's wrong with my kid and they're not like that kid, what's going on? And you just start freaking out.
It
So
can spiral quickly, right? That comparison mindset. And then, yeah, those of us who are prone to having a little bit more of that kind of anxious, that's me. So I totally get it. If your baby hates tummy time and then that's triggering to you to hear them cry. And so then you're going to avoid it. And then it turns into this snowballing effect because then now, oh, maybe now they're not rolling because we didn't do tummy time. And now I'm concerned and I'm Googling, like, why is my baby not rolling? And then, it kind of snowballs. And I understand that from a parent perspective. And so that's why my whole thing is to just get it out there, be that resource for parents to help, them sit back and enjoy and be a parent. I say, like, I'm the therapist. I'm here to do the education and help out and everything so that you can just enjoy being the parent, right?
that's important. Sometimes we need to be able to sort of step back and remember that, like, just enjoy this moment. Like,
Yeah.
a lot of this stuff is natural process. You don't need to be like, see, what does this workbook say all the time? But it's so helpful working with someone like, you in your field where you come up with ideas that maybe someone hasn't thought of, like seeing some of your reels, like, oh, do this with the baby, and then this is fun and educational for them, but you're like, oh yeah, I didn't think of that. It's just a normal, just like adjusting playtime a little bit.
That's my favorite part of my job is when I come in and make like the slightest modification to just like how we're setting them up for play, and it unlocks something and it just clicks and the parents are like, oh my God, like that's so amazing.
Yeah.
And sometimes it's the smallest things, but it's so fun to get to see that on a daily basis. I say I have the best job in the world. So yeah, and it's empowering to help the parents understand that. When I come in and I get so excited about the fact that, oh my gosh, your baby shifted their weight and reached for that toy, and they're like, oh, okay, like I didn't realize that was such a big deal. And I'm like, oh, look, so that's going to help them with rolling, and now they're going to be able to shift their weight when they're ready to crawl, and this is why this reflex is so important. And they're like, oh, so we can be excited about all these other like small little things and not constantly be like, well, why aren't they crawling yet? It's just, it helps so much to just enjoy all the small stuff and not be constantly, like having that milestone anxiety. And they know all these other little things to look for. And it helps give them some reassurance and peace of mind to just be there in the moment.
I know my now 2-year-old, she had torticollis, which is something that I'm so glad that you've talked about on your Instagram a little bit, because no one talks about it. And I happen to have been training as a lactation educator counselor, and we went through torticollis. And then I happened to I was like, oh, let me check with my own baby because that's great. I'm learning. And I was like, oh, she has it. And so, I went to the doctor. Doctor was saying, okay, whatever. But I asked for a referral. And it was so great seeing the PT and having her be like, oh, wow, look at her do this. And look at, because I was feeling in this very negative space and very like, oh, great, she has this. And then now her crawl is like, she's standing with one foot and crawling with the other. Like, how is this going to affect everything? So all those little praises really helped my self-esteem and motivation in working with her too. And it puts things in perspective. Like, oh, there's all these other things going on and working together. There's more than just that main goal.
The one big thing. Yeah. All those other things to me are actually more exciting and more important than, the big ones that we check off the checklist at the doctor's office. Right. And so a lot of that can get missed or fall through the cracks. And so being able to have the kind of social media piece of what I do, I hope that that's what that is offering to people, because I know that, social media can have its pros and cons. And I just want my space on Instagram to be a positive thing for parents to learn about that stuff so that they can enjoy the process and the progress through play.
Yeah, that's awesome. And then I mentioned earlier about containers, so I do want to get back to that because I believe you're talking a little bit about that at the summit.
Mhm.
But one thing that you've shared on your Instagram specifically is safe and, or I guess would safe be the right word? Just containers that limit your child's development versus the ones that might be, okay, this isn't really considered a container, so it's not limiting, but you may,
Mhm.
use this. So what are some things that people should probably avoid? Like, okay, I see that that's marketed for baby, but it's not really a great, product for their development and what they're trying to, you know, do in their growth.
Yeah. So my mindset when I talk to families about this is that I'm a parent too, right? So I understand, especially we're all working from home, and
Right.
since this past year in COVID, there's a time and a place. What's happened is the baby gear industry has a lot of money to market these things to parents as if they are necessities
Mm,
and as if they actually are going to promote these certain milestones or development. And so parents, rightly so, hear that and put them all on their registry, and a lot of them are not cheap. So
yeah.
they're investing a lot in this when truly it's kind of the opposite, right? So they overuse of them can hinder development. But what I tell parents is all you have to do is shift your mindset that a container device, and we say container devices, it's really just anything that you put your baby into. So that could be a swing, it could be a bouncer, it could be an exerciser, it's even the car seat or the stroller. Um, you know, you can think of all the rest of them, right?
Yeah.
Just anything that you put your baby into. All you have to do is shift your mindset. They are tools for your convenience as the parent. They are not a tool to help your baby.
Hmm.
Okay. So once you shift your mindset and think of it that way, and know that there's a possibility for overuse of them to hinder your baby's development, it makes it so much easier to kind of avoid that overuse, right? You're like, okay, so let's plan out my day. When are the times in my day where I'm really going to need baby to be entertained so that I can get something done? Maybe that's a Zoom call, maybe that's just doing the dishes or getting a hot 10-minute shower or whatever it is, but you can think about it in advance and be like, all right, well, that's great. I've planned out my baby may need to be in the bouncer for, about 10 to 15 minutes while I shower, or, in the exerciser, for my 20-minute Zoom call, whatever it is. That way you're doing it in moderation. You're using them sparingly. You make sure that there's not just one in every room, because then you're going to like default to it. Your
Hmm.
default should always be to put your baby on the floor. So that should be your first stop, right? You should always have open floor space that is safe for your baby. And if you have dogs or older siblings or things that make the floor unsafe, there are ways we can work around that, right? Get a pack and play or a baby gate or a little play yard or a playpen, to just give your baby that freedom of movement, because the floor is where they're going to build those skills. They're not going to learn how to sit up by being in a bumbo. The bumbo does it for them.
And what age
So
say, like, obviously you wouldn't want to put like, are you suggesting at like 2 months old or 4 months old? When would you say start putting them, obviously there's that initial like just cocoon, just hold me, please, the fourth trimester. But when would it be appropriate to maybe sit with them on the floor, help hold them up or have them, mommy, to start exploring a little bit on their own?
yeah. I mean, honestly, you can absolutely still put your newborns on the floor. They
Okay.
will be totally fine. So you can start that routine from day one, whether it's only for a minute or two. That's okay to start building that routine. And so babies are fine on the floor, from the get-go, as much
Oh,
as that may seem difficult to put your brand new baby down there. And if you're not comfortable with them being on the floor right away, your chest is totally fine as well, right? You're going to be getting a lot of those little snuggles in. But in terms of then progressing them to being in certain types of containers, that's another big thing that I really push for parents to kind of educate themselves on when their baby, or like what is developmentally appropriate in terms of a container for your baby's age, because that's what I also don't want to see. It's like, if you've shifted your mindset, we're only going to use it for 20 minutes when I really need to do the dishes and all of that. So you've got your check marks, you're not, going to fall into the container shuffle where you just move them from the swing to the bouncer to the, whatever throughout the day. So you've got that down. Your next step is to make sure that your baby is developmentally ready for whatever you may be putting them in. So that means making sure your baby has really good head control before you ever put them in anything sitting up. I see babies slumped like this in those little Fisher-Price sit-me-up chairs, and I'm like, oh, that's going to cause some postural issues, right? And so there's a little checklist, and I have it on my feed, and I'll probably repost it here soon prior to my talk at the FamSummit. But it's just about being intentional, and the second you kind of stop thinking about it is when you can start falling back into that, possibly overusing it, them going from one to another.
Yeah.
And so,
or rushing that milestone, like you said, like there's like a 2-month-old or 3-month-old sitting up in like a bumbo or the sit me up, and it's like, that's no,
I want that baby to be on the floor so they can learn how to roll before they sit up. Yeah.
If you're putting them in that, it's not meaning they're meeting a milestone sooner. It doesn't mean that they're smarter than any other baby. It's just harder for their, they're not ready yet. And that's normal for them to not be ready yet.
Absolutely. Yeah. Don't rush it. Enjoy those little steps along the way, and don't be in a hurry to get them sitting, crawling, walking. They're all kind of on their own pathway to get there. And that's what, when I work with families one-on-one, I am helping them understand what that looks like for their own child, right? Because it's not going to look the same as the checklist at the doctor's office, or, if you Google, when should my baby be sitting up, and it says 6 months, and you're like, well,
no,
that's not helpful, because babies don't wake up on their 6-month half birthday and all of a sudden sit up. So it's just helpful to understand what that looks like for your own kid.
Yeah. And another thing that I think I saw on your Instagram, but maybe it could be from working with people, my own kids. But one thing that I learned more recently, after having several kids, is that each one of those pieces that you've mentioned before, how they all, it's not just that one big thing at the end, like, hey, they're walking, there's all these little stepping stones to get there. And if they skip one of those pieces, it affects a lot of other, motor, fine or gross motor development. So you don't want them to skip things and get to whatever.
Rush to the next thing.
Yeah. Because it's like, we can't even, if you study it, you can comprehend it. But as a parent, somebody who's like, I have no idea what all those little things are, you're not actively thinking about, oh, wait, they need to master all these tiny things. They can't skip them and go to this big thing, or it'll show up in some other thing later. And that's something kind of important to think about. I learned that this year, and I was like, oh, wow, that makes sense. Like, my 4-year-old does this a certain way because they this when they were a baby. It's really interesting.
Yeah. And it's exactly those types of things that as a pediatric PT, I kept seeing over and over again, and was like, I got to start from the beginning, right? I got to get out there and kind of change the model of this, like, kind of reactive care of waiting until there's a big red flag or an issue at 4 years old, and just try to get parents understanding this early on. And so that's kind of why my practice is a little different than some of the traditional, physical therapy clinics and things like that, because I'm coming to your home, whether it's through the computer or if you're in Denver, I'm actually in your home. So I'm looking at your whole routine. I'm helping you figure out exactly where you're putting your baby when and how. And I'm sitting there as their cheerleader, like getting so excited that they just like bent their knee up to the side and tummy time, you know, just these tiny little things.
Well, that's awesome.
And
So someone doesn't need to be local to you to reach out to you and get support. Since
absolutely. So I have kind of two different sides of the practice, one of which is actual, you know, physical therapy and in-person services here in Denver. But I do what I call like milestone consults for people virtually, where it's just this education, right? It's not like, you know, your child is potentially delayed or needs a full evaluation and physical therapy treatment, but it's more just helping you understand what all these little pieces are so that you can feel good about sitting down on the floor and, you know, kind of creating some purposeful play opportunities for your little one to help kind of set that foundation. And so it's that proactive piece,
what's going
that wellness piece of this kind of spectrum of care. So yeah.
Awesome. And then what, so let's say that they haven't noticed any like red flags necessarily. What age should someone reach out to you or physical therapist to just, you know, get their baby checked out if they didn't see any red flags, just to make sure they know what they're doing, you know, can
Yeah.
tools that they possibly could.
You know, if you're just looking for that kind of education and support to kind of help set that foundation, I would say kind of towards the end of that fourth trimester, right? Because I want parents to be able to bond and focus on feeding and creating, you know, that bond with their family, and then you know, kind of be able to focus on that. I do see kids earlier than that all the time, especially my little ones with flat head or torticollis. For those ones, absolutely call right away. The earlier we get those kiddos in, the quicker we can work that stuff out. But if you're just looking for some kind of milestone education and stuff, like 2 to 3 months is a great time to, you know, kind of get some ideas for, you know, what tummy time is going to look like going forward. Now they're starting to be able to actually lift their head. So like, what does that look like at 3 months versus 6 months? And kind of knowing what expectations to have for your baby can be so helpful. So you're not like, why aren't they rolling over? And I'm like, they're only 3 months old. So yeah, so that's a great time to kind of, you know, dip your toe in the water and start to kind of come out of that haze of the fourth trimester, right?
Yes, that sounds perfect. And then for those who are wondering what torticollis is and the flathead and what that might look like, on the Progress Through Play Instagram, there are some images, and I think you have a video so that you can actually see, oh, that's what that is. And I find that very helpful because aside from, you know, maybe your baby being in the car seat or the crib and getting flathead that way, there's different things that happen with the head from birth as well.
Absolutely.
And I feel like sometimes it depends on your provider, but I know like I had a pediatrician who was like, oh, it's okay, baby's head soft, it'll slowly correct itself. And then my daughter was 2, and I was like, I still see a difference in her skull, you know, and I had to work with a chiropractor to sort of work through that a little bit more. So you kind of have to really follow up and be like, no, I want that referral, you know, better to, you know, double check to then be like, oh yeah, it's okay, their head's soft, it'll grow, you know.
Yeah, there's a lot of misconceptions out there about baby heads that I kind of have to work hard to kind of dispel those myths. But the idea is, number one, there's absolutely no harm in getting an evaluation or an assessment for your kid. Best case scenario, like they don't need me at all, and then you just get a bunch of information from me, and you know, you're off to the races. And then on the other side of the coin, if they do need some help, great, you reached out early, that makes it that much easier. We'll get it done quicker, and you have somebody on your team so that you feel good about, you know, setting your kiddo up for success and knowing that you did everything you could. And sometimes, unfortunately, you have to be the one that
Mm-hmm.
does that advocating and reaching out on your own, because there are providers out there, yeah, who might kind of brush that off or not really listen to your concerns.
Notice it because they're not trained in that area.
Yeah.
Um, but I feel like sometimes, pediatricians, they're very authoritarian, like they're an authority. And so I feel like if they don't know something, instead of saying this isn't my specialty, they just say, you know, they say no, it's fine, rather than acknowledging that they're not educated enough in that space.
Yeah.
That's only my experience. Every different, every pediatrician is different. But
Yeah, it's hard. And so you don't know what every pediatrician's background is or understanding of it. And they truly are concerned about your child in a medical sense of like, are they growing? Are they thriving? Are they healthy? And oftentimes things like, these smaller aspects of motor development or small asymmetries in their posture or their range of motion or, whatever might get missed. And I have seen it a million times over. But what I tell parents is you are the expert on your baby.
mm-hmm.
You see them all day, every day. Your pediatrician sees them for what, 15 minutes every couple months?
Right.
And you are the one that
even that they glance over and then come in and talk to you about. So
right. Yeah. So I just want parents to feel empowered to find the support and the resources that, help validate what they are seeing in their child, because while I might be the expert in motor development, you are the expert in your baby. So I hope that, through kind of the education that I do on my page, that parents might see that and know, like, yes, that looks like my baby. And maybe the pediatrician didn't see it last time, but I'm going to go ahead and just reach out now. I'm not going to wait for our 6-month appointment, because I saw this and I know that the earlier I reach out, the easier it'll be. So
there's so much that changes each and every day with the baby.
Exactly. And I hear parents all the time where they're like, well, I noticed this, but we have a pediatrician appointment in like 3 weeks. So, we'll just wait and see what they have to say. And I'm like, do you know what I can do with a baby head in 3 weeks? Like, a lot happens, especially with infants in 3 weeks. They are a completely different baby. So yeah, I do want parents to know that they can be those advocates and that they know their baby's the best, and to get second, third, fourth opinions if they feel like they're not being heard by whichever provider, even if it's a physical therapist or whoever they might be seeing. If you don't feel heard or listened to, or you don't feel like it aligns or validates your concerns, and it doesn't sound like what you're seeing in your kid, go find somebody who you find that connection with and who really listens to you and sees your whole baby. And that's what I hope parents can feel empowered to do.
Well, thank you for sharing all that information with us. That's so important. Just working with your baby, the fact that you can make slight adjustments during playtime and it can affect their whole life. It's not just about meeting that walking milestone.
No, it's much bigger. It's much bigger. Yeah.
Well, I cannot wait to hear more at the FamSummit. Thank you for taking the time to talk a little bit about it today.
Of course.
I don't see any questions yet, so I'll let you go, and then I'll see you later at the summit.
Very soon. Yeah. Okay. Thank you so much for having me.
Have a good weekend.
Thanks. You too.